Welcome to the Lifestyle First podcast, discussing lifestyle medicine and making self-care as easy as 1, 2, 3. 1 question, 2 research reviews, and 3 actionable health tips, all centered around the Lifestyle First method, your blueprint for the 10 key routes of optimal health and happiness. And now your host, lifestyle medicine physician and coach, Dr. Alka Patel.
Hello and welcome to Season 5, Episode 4. Today we are of course continuing to take a deep dive with my co-authors into the book A Prescription for Healthy Living. The theme in the Lifestyle First method we're exploring today is E, exercise. And the one question we're discussing is, how does being sedentary affect my long-term health? 2 references to support today's discussion are the chapter on sedentary behaviour in A Prescription for Healthy Living and the very well-known 1953 Transport Workers Study. Emma, I am delighted to have with me, back by popular demand, Dr. Emma Short. And you'll remember Emma opened up this podcast season with me. So she is the editor of A Prescription for Healthy Living, and she's a histopathologist with training in mindful nutrition, Shinrin-yoku, meditation, and personal training. The list goes on. So Emma, welcome back. Today, we're looking at the book chapter that you wrote on sedentary behaviour. So I'm just going to dive in. Let me just start by asking you then, what does being sedentary mean? How do you define it or quantify it?
So, hi, Alka. It's lovely to be back. Thank you for having me. So I think all of us know that being physically active is really important. Regular exercise increases your mental well-being. It reduces the overall risk of death, reduces your risk of heart disease, diabetes, high blood pressure, certain cancers, and a whole host of other problems such as falls, dementia, back pain, bone problems. But what's less well known is that as well as being physically active, it's also really important not to spend too much time sitting. And over the last decade, we've had a huge explosion of evidence which has shown us that sedentary behaviour is an independent factor that's associated with adverse health outcomes. So whilst an individual may fulfil their exercise requirements, they can still be classified as being sedentary if the rest of their time is spent sitting. So physical inactivity and sedentary behaviour can be viewed as separate entities, each with their own health consequences. So there's a sedentary behaviour research network, and they define sedentary behaviour as any waking behaviour characterised by an energy expenditure of less than or equal to 1.5 metabolic equivalents while in a sitting or reclining posture, which basically means that sedentary behaviour is sitting or lying whilst you're not doing much else. So all of us are really accustomed to doing lots of sedentary activities. So it includes things such as watching the television, sitting, working at the computer, driving, or sitting and listening to music or reading.
Brilliant. That's really helpful, just a bit of that kind of quantification of it. Can you translate that into hours at all? So how do I know if I'm sedentary depending on how many hours I'm clocking up sitting?
So I'll talk about that a bit later when we talk specifically about prolonged periods of sedentary behaviour and total sedentary time. But basically, as soon as you're sat still, you're sedentary.
Yeah, no, okay. And what do you think's happened over time? I mean, we've not always been sedentary through the sort of evolution of man, have we? How have we actually changed our sort of activity patterns? And what do you think are the key influences of that in the sort of times that we're living in right now?
Yeah, that's an incredibly valid point. So human beings are designed to move. The human body is built to be active and to engage in manual labour. And throughout evolution, this was essential for our survival as a species. But studies have shown that sedentary behaviour has increased really since the 1960s. And in the UK, sedentary time has increased from 30 hours a week in 1960 to 42 hours a week in 2005. Data from America supports this. So a large study looking at nearly 52,000 individuals found that 62% of children watch television or videos for at least 2 hours a day currently. And the same figure is the same fact is true for 59% of adolescents, 65% of adults aged 20 to 64, and 84% of adults aged 65 and above. Overall, currently it's estimated that adults spend an average of between 9 and 10 hours every day sitting. And I think one of the key reasons for this is that there's been a change in the patterns of employment since kind of the 1950s, 1960s. Traditionally, we worked in construction industries, farming, manufacturing, whereas now the workforce is increasingly office-based. And what's gone hand in hand with that has been a rise in screen time. So between 1989 and 2009, the number of households with a computer and internet access increased from 15% to 69%. So I think it's both factors. I think it's the fact that our working patterns have changed, and also that we've got increased access to televisions, to the computers and to the internet.
Those are staggering figures, actually. I'm just sort of reflecting on some of those numbers. So 9.5 hours a day sitting. In theory, we're sleeping 8 hours, or at least we should be. So the numbers really kind of, are stacking up, showing really not moving that much in our day, despite saying, I'm going to pump it out at the gym later, I'm going to go for that half an hour walk. We're still spending so many hours in our day.
One particularly surprising and shocking fact really is that more than 40% of adults between the ages of 40 and 60 in the UK don't even achieve 10 minutes of brisk walking in a month.
In a month?
Yeah, less than 10 minutes over the whole of a month.
Yeah, I think it's about becoming more aware, isn't it? It's being conscious. I mean, I know I'm sitting right now recording this, but I have been standing all day working and consulting and on my phone and in Zoom meetings, and all these things are possibilities. You can do these things standing up, but we default to sitting, don't we? Because it's our default position. So that's really interesting. But before we get to what we can do instead, which is really where I want to sort of take this, I think it's really important to understand, what is that health impact? What are we doing and what are we losing by doing what feels comfortable, which is to sit?
So it really is undoubtable that sitting still for prolonged periods of time has a negative impact on health and well-being. And this has been known for a long time. So most people have heard of the famous London Transport Workers study in 1953. And that study reported that the bus drivers had significantly higher rates of heart disease than did the conductors. So the drivers were sat down all day, the conductors were walking about on the bus all day. And interestingly, it was also observed that if the conductors did develop heart disease, it occurred at a later age than the drivers and was less likely to be fatal. Increased sedentary time overall is associated with a poorer health-related quality of life and increased symptoms of depression. Depression, tension and anxiety are all positively related to total screen time, as are other psychological parameters such as stress levels and perceived tiredness. But it's also just to bear in mind that it's not entirely clear whether this is a causal effect. So are people sitting still because they have symptoms of depression and anxiety, or are they low in mood because they spend too long sitting still? And the same question arises really when we consider cognitive impairment. So patients who have mild cognitive impairment show lower levels of physical activity and higher sedentary behaviour patterns than do patients without such impairment. But it's not entirely evident whether the cognitive impairment is related and results from a lifetime of inactivity, or whether it's the patient's diminished executive function, which means that they're less likely to engage in physical activities and in being mobile. There is a big, substantial body of data which confirms that sedentary behaviour increases the risk of developing metabolic syndrome, type 2 diabetes, heart disease, and it increases the overall risk of death. There are certain cancers that are associated with sedentary behaviour, and these include lung cancer, uterus or womb cancer, and bowel cancer. Interestingly, in adults who are over the age of 60, it's been found that self-reported sitting time is associated with certain biomarkers in the blood, which indicate frailty. And that paper reported that critical sedentary times are over 257 minutes per day for every male and over 330 minutes per day for females. Another study looked at nearly 2,000 adults aged between 40 and 75, and that found that increased sedentary times were associated with a shorter distance covered in a walking test and lower elbow extension strength, which indicates that sedentary behaviour is associated with poorer physical performance. And when we're talking about sedentary behaviour, something that's also really important to be aware of is that we're talking about both the total amount of time sedentary, but also prolonged uninterrupted sedentary bouts, and both of these are associated with an increased risk of death. For example, individuals who sit for more than 13 hours a day have a 200% greater risk of death than those who sit for less than approximately 11 hours a day, which I think is quite a dramatic figure. And those who sit for stretches of less than 30 minutes have a 55% lower risk of death than those who sit for more than 30 minutes. So when we're talking about sedentary behaviour, we're talking not just about the total sitting time, but those uninterrupted sedentary periods, which highlights the importance of just getting up and moving as often as you can.
Yeah, that's really useful to know, because I think it'd be easier to think, oh, well, I'll just reduce my total sitting time, but actually you've got to be doing something in between that sort of
Absolutely.
well.
Yeah, absolutely.
So can you just negate the effect? I think a lot of people do think that, look, I'll carry on with my work all day long, and then I'm going to blast it out in the gym or go out for a run, and that's my exercise done. Do you actually negate the impact of sitting by exercising? Is it sort of that balance?
That's another really good point, because I work as a histopathologist. I'm a registrar in pathology. So most of my working day is sat at the microscope, looking down the microscope, looking at slides. And up until the last couple of years, I'd always thought that I would be fine because I do a lot of running. I run 3 or 4 times a week. So I thought, it doesn't matter, I sit most of the time, I'm running. However, data from over 1 million individuals, so a huge database, has shown that in order to eliminate the increased mortality, so the increased death risks associated with high total sitting time, individuals need to engage in 60 to 75 minutes of moderate intense physical activity every single day. And for those individuals who watch television for 5 or more hours daily, even that level of activity doesn't completely eliminate the increased risk. So if you are sitting for a long time, in order to negate that, you really have to engage in very high levels of at least moderate intense activity outside of your sedentary period, which is actually very hard to achieve that balance.
Yeah. Whereas actually it's easier to do it in the hour, isn't it, actually, rather than piling it all up. To do that level of intensity is very difficult to achieve for most of us. But I guess it's probably what I'd like to understand is the how on earth does sitting make all this difference? What's actually sort of going on in our bodies? Do we know what those mechanisms are that actually create that risk?
So this is really interesting. This is an area which has been actively researched at the moment. At the moment, it's not entirely certain what mechanisms mediate the increased risk of these adverse health outcomes. However, it's thought that the most likely reasons are through modulating metabolic parameters such as insulin sensitivity, through increasing levels of body fat, altered production of sex hormones, and increased levels of systemic inflammation. But these are areas that are being actively researched at the moment to actually pinpoint what it is about sitting that causes such a high risk of adverse health outcomes.
Yeah, okay, so that's useful to know that there's certainly sort of research being done. But has anyone pulled it all together at the moment? Is there any guidance that we can get some absolute sort of clarity on X number of hours and Y number of minutes? What's the guidance out there telling us to do at the moment?
So we definitely need guidance. I think that once guidance is released, then people are more likely to listen and take notes. But at the present time, there isn't sufficient evidence on which to base public health recommendations. The general advice, which is very well talked about, is to sit less and move more. The UK government recommends that all adults should minimise the amount of time spent being sedentary for extended periods. But as of the moment, there aren't any guidelines which say how often we should move, what should be our maximum duration of sitting. The message really is just to sit less and move more. So move at every opportunity you can.
And now, here is your lifestyle first prescription. Your 3 activating actions to take you from knowing to doing.
How are we actually going to sit less, move more? Have you got some tips for us today?
Yeah, so in one of your previous podcasts, Dr. Fallows put her action points into the 3 S's, which I thought was a lovely way of doing it, and it makes it easier to remember. So I've put my action points as the 3 T's, which are timer, talk, and television. So the first is timer. So set a timer to go off, ideally at least every half an hour, but more realistically, probably every hour. So you can set a timer on your phone or on your watch, and just whenever it goes off, move your body. So get up, walk around the room. You could do some squats or some lunges, but just something to get your body moving so that you're not sitting still. The next T is talk, and we spend a lot of our time on our phones, and it's very easy to have a chat sitting down on the settee, but the T is just to remind us that when we're talking on the phone, make a conscious effort to get up and walk around rather than sitting still. And then the third T is television. So a lot of us enjoy watching television now and again, but ideally when we're watching television, try and keep active if you can. So even you could do boring chores, stand up and do some ironing, you could do some yoga stretches, or if you don't want to be moving the whole time, just make an effort that whenever there's a break, for example, an advert break, try and get up and move then. So walk up and down a flight of stairs, go and pop the kettle on, or even just walking around your living room is brilliant. The key message really is just to move as much as you can, sit as minimally as you possibly can.
Yeah, I think that's also easily actionable, isn't it, actually? And the timer bit's interesting because actually by having a timer and moving, not only are you increasing your activity, but there's a link between productivity and having breaks as well. So you're focused on the task and are not taking regular breaks. You think you're just going to keep going. If you have a break, your productivity really increases. So you've got a real sort of, double game there as well. And really funny when you talk about the sort of television part. I several years ago bought myself a power plate with the intention, of course, that whenever I was watching TV, I could stand on this power plate and be moving and doing all sorts of things on it. And I think that's really interesting to do, is just to be aware that you can do multiple things at the same time, which is key to things. You don't have to just sit to watch TV. And it's funny about the ironing. I did once actually stand on the power plate whilst I was ironing as well. So, and it's just thinking about it. And the talk, I think, is really powerful, isn't it? Because most things, when we're talking, whether it's Zoom meetings, listening to, conversations, joining in on our phones, we can do all these things. We can walk and talk. We can do all of that.
Absolutely. And even just standing up is better than sitting down.
Amazing.
And there are you can get under the desk bikes, so you can get them for around £10. So if you do have to sit at a desk all day, you can get a really cheap under the desk bike, or you can get under the desk steppers for for small amounts of money, and that's something that then means you're not just sat there doing nothing.
Yeah, I bet it's funny. Again, you're saying all the things that I've got. I've got one right under my desk here, and in my surgery, when I was signing my prescriptions and reading my documents, something that I could now, thinking about it, have done standing up. I was actually cycling on my little cycle whilst doing that. So again, it's just keeping these things at the forefront, and it's actually fun. Like, it makes it quite.
Yeah, it does.
It's fun to be much more agile and moving about when you're doing things, actually. So,
and then it becomes a habit. If you do it regularly, it becomes a habit, and you don't have to think about doing it.
Yeah, no, amazing. Thank you so much, Emma. It was fantastic listening to you. Gave us so many statistics and a lot of data and real insight. And I think three very, very tangible things that we can all do very quickly to just change that health impact pretty quickly. So thank you so much. I know, again, people do know how to find you from a previous episode, but just tell us again, how can people reach out to you?
So I'm on Instagram as @Dr_Emma Short, and then our webpage is www.energizehealth.org.
Amazing. Thank you so much, Emma. Lovely to have you.
Thank you very much. Thank you. Thanks, Alka.
And before I bring today's episode to a close, a reminder that the doors to the Lifestyle First Academy are open with a course designed to help you to discover, notice and activate who you are, what you want and where you are going so that you can create a happy, healthy lifestyle. And I would, of course, love you to subscribe to this channel. The links are just below. So just subscribe and share so that you too can help spread messages of health that matter. Which simply now leaves me to say, as always, I wish you a happy, healthy day.
Thanks for joining us on the Lifestyle First podcast, making self-care as easy as 1, 2, 3. Don't forget to subscribe and share. And we'd love it if you'd be kind enough to leave a review. To learn more or to arrange a consultation, please visit www.dralkapatel.com. See you next time.